Welcome back. We're joined now by two women who have spent considerable energy studying and writing about the Black maternal mortality crisis here in the United States. Dr. Monique Ranford is an OBGYN and has written about how the disparities in healthcare impact Black women. Dr. Ranford is the author of Pregnant While Black. And Elaine Welteroth is a journalist and author. She's written about how her decision to use a midwife for the birth of her son was the best decision she's ever made, and she joins us from Los Angeles. I appreciate you both being here. All right, Dr. Ranford, let's start with, is there any biological difference between white women and Black women when it comes to giving birth?
That's a loaded question in a way. Genetically, when we talk about the genetics we were given, no.
Right.
But has racism or chronic stressors had an effect on our biology? Yes. It has accelerated the aging of Black women by 7.5 to 10 years because of chronic stressors. And so a Black woman at 25 years old may have the biological age of 35 years old.
Is this what you refer to as weathering?
Weathering.
Yes.
That's a great term, and Arlene Geronimus coined that term.
Basically, so that it is, you're just, if the average woman has an at-risk pregnancy supposedly starting at the age 35, what you're saying is that a Black woman at, say, 27 is an at-risk pregnancy. Is that another way of looking at it?
That is another way of looking at it, yes, and that is only part of the story.
So why then, what would be your explanation for why Black women are 3 times more likely to die in childbirth?
Part of it is because of this premature aging, for societal factors, actually. Another part of it would be how they are treated when they get into an institution of care. Another part of it would be the lack of quality of some of the places where they have to get care. Another part of it will be that when they have concerns, they're not listened to. Another part of it would be that they come in not prepared for pregnancy medically because they don't have access to enough care before they get pregnant.
They haven't done the 1-month check, the 3-month check, whatever it is, all of it,
well,
you know,
not
because they haven't
really.
had access to it?
Well, not even the 1-month check. So if you go into pregnancy and you have a health condition, you need to go into pregnancy healthier.
Right.
You need to have care before. Guess what? If you don't have any insurance before you get pregnant, you cannot get care before pregnancy. Right. Or if your access is limited because of the type of insurance that you have.
So this is obviously a very American issue, because when you look at these birth rates, both maternal mortality rates here in this country, white and Black, are much higher than the Netherlands, Japan, the United Kingdom, Canada. What would be that explanation?
So some of it is, you talked about in the story earlier, like some hospitals closing, lack of access, the maternity deserts. So even if women want to get care, even if they have some of the resources, their only option may be a hospital that doesn't have an obstetric provider of any sort. And so that obstetric provider may not know the right things they need to know to care for the women. And it takes too long to get to the facility that can give them the care they need, and that can be deadly.
Let me shift to Elaine Welteroth here. You wrote about the decision to go with a midwife, and hearing everything Dr. Ranford just said, it almost seems as if every pregnant Black woman in America ought to get a midwife. Tell me why you think it was the best decision you ever made.
Well, first of all, thank you so much for having me, and thank you for shining a light on this issue that unfortunately we don't think about enough or talk about enough until it's too late. I will say that I feel incredibly fortunate to have had the awareness that midwifery care could be an alternative option that could make me feel safer going through my pregnancy journey and certainly through my delivery experience. I'm someone who, I have access to all of the best resources here in LA, and I thought I wouldn't have trouble finding a doctor in, the traditional medical care system that that's been normalized for me to have my baby in. And unfortunately, it was incredibly challenging for me to find a doctor that made me feel safe, understood, listened to. I had I had incredibly difficult, painful experiences with doctors. I ended up going through a series of doctors, just dating different doctors to try to find someone that made me feel safe, especially in the face of this looming crisis, maternal mortality crisis that we're in, that I knew disproportionately impacts Black women. So when I learned about this alternative, by that point, I was so disheartened by the experience I've had with doctors, that I was more open-minded to it. And when I tell you the care that I received, there was a night and day difference. The appointments at the doctors were 15 minutes, maybe max. I was literally told by a doctor that I could ask max 2 to 3 questions. I was rushed out of appointments. I was belittled. I was talked down to. I'm an educated Black woman, and I was belittled in the presence of doctors. When I came under the care of Kindred Space LA, under the care of Kimberly Durden, who's one of the co-founders, she spent at times over an hour with me. She talked to me about my holistic health, my diet, my relationships, my mental health, my emotional health. She went deeper with me than any doctor had ever done, and really equipped me with a sense of self-trust in my body and in this process, and to the point where by 36 weeks I agreed to do a home birth. And for me, that was a huge leap to get there. But for me, it felt like the safest option, and I'm really blessed to say that I had not just a safe birth, but I had a beautiful, joyful birth. And I share my story to empower other women to explore alternative options if you're not finding the care you need in the traditional medical care system.
Elaine, if you don't mind, explain what the difference is between a midwife and a doula.
I'm glad you asked, because I think there's a lot of confusion around that. So effectively, midwives are there to help catch the baby. They are there to give you prenatal and postnatal health care. They attend to your needs just like a doctor does. A doula, however, is there for the mother. So in the birthing room, the midwives are there for the baby primarily, and the doula is there primarily for the mother. They are there all throughout the pregnancy journey to coach the mother through all of what can come up during pregnancy. They're there to help with nutrition. They are there to prep the mother for birth. They're there as emotional support, mental support. You know, pregnancy is a very isolating time. It's a very overwhelming time. And so they're there also, most importantly, they're there as your advocates in the birthing room. If you are delivering in a hospital system, the doula comes with you, and they attend to you. They are right by your side to be your biggest advocate in the room.
Dr. Ranford, how would you advise a woman? Would you to do a midwife, to do a doula? Is there a specific circumstance you should go down that road, or should that always be the path someone takes?
The best scenarios I've seen of my career is when midwives and doctors work together. If you have that relationship, if a woman is higher risk, has more high-risk issues, and she needs an obstetrician, then when you have that partnership, she can have the benefits of midwifery care and the benefits of the expertise of an obstetrician.
How often are OBGYNs open to working with midwives?
I think more often than you might think.
Okay.
Because in the center I work with, we work with midwives all the time and advanced practice practitioners. And I've worked with midwives throughout my whole career. There are some women who go into pregnancy more high risk, and they may need physicians from the beginning of pregnancy. If they're low risk, then they can have midwives. And as I said, the sweet spot sometimes if they have the benefits of both, and sometimes that can be available for some women depending on their risk factors.
Elaine, look, you obviously did a lot of your own research. You were concerned. Do you feel like we need to educate people about the availability of midwives and doulas? I mean, I think a lot of young women may not know about that this is an alternative way or a more personalized way to go through this process.
Absolutely. Absolutely. I'm here to tell my story for that exact reason. I think we need to expose birthing people in this country to all of their options and educate them on all of their options. And also there needs to be, frankly, a cultural shift to normalize some of these out-of-hospital options that are providing greater
You wrote about
care,
this. There has been this sort of,
women.
there's a weird stigma that comes with birthing at home, right? I think you even said, oh, it's the, the crunchy granola, right? And it turned out that's sort of an intentional myth that's out there, isn't it?
Absolutely. Listen, I will be the first to say I didn't think about having a home birth. My mother, my grandmother, most of the people I know have all had births in the hospital. So I am the perfect sort of candidate to say I misunderstood what it meant to be a mom who gives birth out of the hospital with a midwife and doula support. I had to educate myself about this option, and I had to kind of deconstruct some of the stereotypes that I associated with home birth and with midwives. But what I came to understand as I unpacked this issue and looked at it through a historical lens is all of the myths that we hold in our mind around midwives being the lesser safe option, right. Them being sort of a hippie freestyle alternative path of mothering that maybe is only for these sort of, as you say, granola moms. Those are deliberate, constructed ideas that are part of the propaganda that was used to eliminate midwifery care from this country. And when you actually go back, you realize that midwifery care gave birth to this nation.
Sure.
This is the original
We didn't have a lot of hospitals in the 18th century
birth.
or the 19th century. There weren't a lot of maternity wards, right? I mean, this was the only way.
Exactly.
Yeah.
Exactly. And when you look at the introduction of obstetrics, the maternal death rate has only skyrocketed since the introduction of obstetrics. So it's important that we deconstruct why we think of midwifery care and out-of-hospital births as less safe when the data does not support that.
Final question for you, Dr. Ranford. It's clear we have an access issue. And I guess the question is this an access, is this a rural hospital issue? Is this not enough OBGYNs, not enough OBGYNs of color? What's line item one here of trying to solve?
I think it's all of the above, but certainly we need to train more OBGYNs of color. We need to train more midwives of color. We need more doulas to support our women. So we definitely need all that. And then we have to look at the hospitals that we have. We have to make sure the quality is great in those hospitals. We can't have substandard quality because we'll have bad results. So many facets.
Absolutely. Monique Ranford, Elaine Welteroth, thank you both for sharing your expertise and your personal stories on this.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.